Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent in Washington. And today we have with us Professor Benjamin Sommers of the Harvard School of Public Health. Professor Sommers is a physician and a leading expert on the U.S. healthcare safety net. And he's here to talk to us about the Affordable Care Act's expansion of Medicaid. Greetings, Professor.
Thanks for having me.
As we all know, the Affordable Care Act calls on states to expand Medicaid to cover nearly everybody with an income of up to 133% of the federal poverty level. But in 2012, the U.S. Supreme Court allowed states to opt out of the program. 2 years later, about half of the states in the country are moving ahead with implementation, and 4 or 5 are still debating, while the remainder are not moving forward at all. One of the biggest debates in the country is brewing in Virginia, just outside of Washington, where Democratic Governor Terry McAuliffe is pressing for an expansion in the face of opposition from Republican legislators. They have until July 1st to work out a deal or risk the possibility of a government shutdown and a downgrading of Virginia's bond credit rating. So let me ask you this. What do you make of the situation that's unfolding in Virginia? And is this the sort of thing that other states that are debating the expansion can expect to see as they move forward?
I think what we're seeing in Virginia is primarily right now the result of divided government, of a Democratic governor who's supportive of the Affordable Care Act and expanding Medicaid coverage, and a state legislature that is led by Republicans that continue to oppose the law in general and the Medicaid expansion in particular. So the details are a bit different state to state, but what we're generally seeing is this ongoing debate in many of the states that have yet to expand, where on the one hand you have large vested interests pushing the state to expand. This includes hospitals, insurance plans, patient advocates, physicians groups, in some cases even the business community, saying this is an opportunity to bring a lot of federal money into our state and to boost our healthcare system and to provide coverage to a low-income population that doesn't have it. And on the other side, though, you have the conservative ideological opponents of this law that simply do not think it's a good law and do not think that expanding government provision of health care through Medicaid is a good policy decision. And so this debate is taking a different form in states where there isn't divided government. In Indiana, for instance, we're seeing a debate going on between the governor and the state house where all of them are Republicans. Or at least the Republicans are in position of leadership, but there's debate over whether doing any kind of expansion of Medicaid, even under different arrangements than the traditional expansion, is something that conservatives can support. So what's in Virginia, what's in Indiana, what's happening in Pennsylvania, these debates are going to continue for a while because there's so much money at stake and the political component of the law remains so controversial.
Now, Arkansas, which is also a divided state, was able to overcome political and ideological opposition by innovating, and what they did was to come up with a plan that uses Medicaid expansion funds to provide private insurance to low-income people through their state's federally facilitated health insurance marketplace. Now, that was held up at the time when it first came out as a model for other states in the South and states elsewhere with conservative leadership. Has it actually turned out to be a model for other states?
Well, in some ways, it has been. I think we've seen some states that have moved forward with elements of the Arkansas approach. For instance, in Iowa, which has received approval from the federal government and is expanding in 2014. While they're not using private insurance for the full income range in Medicaid, they are using it to cover those who are between 100 and 138% of the federal poverty level. But what Arkansas opened the door to is the possibility of expanding and accepting these federal dollars, but finding a way to do so that's potentially more palatable to conservatives. So whether that's using more private insurance instead of Medicaid, whether that's using greater cost-sharing requirements or premiums, work incentives and other such incentives in the system. All of these are options that states like Indiana, like Pennsylvania, like Iowa have been pursuing as they consider their own Medicaid expansions. And I'd say that Arkansas really kicked off this process where states saw the opportunity to negotiate with the federal government for more flexibility that might make the law more palatable to expand Medicaid in their state.
Are all of these states then pursuing innovation, or are they simply pursuing a kind of privatization of Medicaid that has been underway more generally for a number of years?
Well, there is a general trend that's been pretty clear in all states, or nearly all states, towards the use of Medicaid managed care plans as a way of delivering health care to people enrolled in Medicaid. And this has been particularly true for the people coming into Medicaid under the Affordable Care Act. And this is true whether you're looking at conservative states or liberal states. Nearly all of those who are expanding Medicaid are doing so heavily reliant on private managed care plans. It does raise the question of, well, how different is it to put somebody in a privately subsidized plan like Arkansas is doing versus putting someone in a Medicaid managed care plan run by a private insurance plan? And I think there are reasonable differences of opinion on this issue, but some of what we're seeing going on in these negotiations isn't necessarily about the actual policy differences, but in some cases is about how they appear. And the appearances are quite important when you take a politically controversial law like the ACA. And so some of the negotiations are about true policy differences and trying to do innovative things and requiring greater contributions or different requirements on people in Medicaid. But I think a good portion of the debate is also about framing a Medicaid expansion in a way that gives a conservative governor cover to say, look, we didn't just take Obamacare as is, we put our own stamp on it. We made sure that we got some concessions from the federal government.
Interesting. And in the meantime, there are 20 or so states that are not moving forward at all. What is life like for elected state officials within those jurisdictions? Are they sitting tranquilly on the sidelines, or are things happening behind the scenes?
I think things are happening behind the scenes. In some of these states, the political pressure is quite strong from many of those stakeholders I mentioned earlier. There are a lot of economic incentives to states to do this expansion, and so that isn't going to go away. The hospitals, the physicians groups, the patient advocates are not going to stop talking about Medicaid expansion, even in states where it seems its political prospects are quite poor for the next few years. But the other part to recognize is the difference between being a statewide office holder like a governor, where you really do have to take into account all of these political considerations from multiple stakeholders, many of whom support expansion. And then if you take the perspective of some of the state legislators who are often taking the most vocal lead opposing the expansion, many of these legislators are from districts with few people who would be eligible for Medicaid, where conservative ideology is so strong that there's very little downside to them of opposing the expansion. So I think we will continue to see some of those debates play out as long as the ACA remains politically as controversial as it is now. I think that controversy will settle down over the next few years as the reality of this law takes hold. And in that case, you may see that the economic arguments start to drive the state decision making, and some of the political opposition will wane. But that may take a while.
What's your prediction overall? Do you think that there will come a time when states will sort of pile into the Medicaid expansion en masse, or do you think reality will be different?
I don't know that there's a tipping point per se. I think more likely is that we'll see an increasing number of states over time finding a way to get to yes that satisfies their political constituents, but also brings in all these federal resources. And we're seeing that over the past 2 years as several more states have come on board. The number who are in the staunch no category is shrinking gradually. And I think that will continue to be the case, especially as the president's term ends and we're no longer kind of debating this as directly about President Obama, and it becomes more of a statement of local politics. I think much like what we saw in 1965 when the original Medicaid law was passed, states took a while. For the first several years, it was a stream of states, but it didn't all have full participation until actually the early 80s, when Arizona was the last state to come on board 17 years later. So that may play out again, and I think it won't happen immediately, but it probably will happen for most states over the next 5 to 10 years.
Given that the struggle over the Medicaid expansion is in many ways a national struggle, whatever the outcome is in Virginia at the end of this month, Do you think there will be implications for the debates underway in other countries? Do you think there will be implications for debates underway in other states?
Yes and no. I mean, all of these states are paying attention to one another, and in particular, in the last few days, we've seen both the governor and legislators in Virginia appealing to the example of Governor Mike Pence in Indiana for and against a Medicaid expansion. So, they are listening to what's happening elsewhere, but ultimately, these are really state-level decisions where the state vested interests are what's going to drive the ultimate outcome. So, again, I don't think any one state holds the key to all of the others coming on board. They're all kind of, to varying degrees, dealing with the same forces at play, and that's why I do think the general trend will be towards more of these states coming on board with the expansion. But I don't think we're going to suddenly flip a switch and they'll all jump on at once.
Thank you very much for shedding light on a very complicated topic. And thanks too for the viewers for joining this edition of Health Reform Watch. I'm David Morgan. See you next time.